Mary Rousseff. I'm the communications lead for the Chronic Disease Control Branch. I have some of my colleagues here. Raise your hand. Here. So we have a public health representative over here. And I wanted to take time today to talk about what our department is doing to help prevent diabetes and how we're leveraging the National Prediabetes Campaign. First, I wanted to ask who is in the room. I've been to about 3 or 4 of these, but I still wanted to get a sense. I heard lifestyle coach. Is that right? Is that the terminology? Or how many people work on lifestyle change programs and other? Okay. Yeah. And then nurses. I see some nurses. Yeah. And then doctors. Okay. Perfect. And public health. Okay. Wonderful. I would like to get to know who I'm talking to. So this is our funding acknowledgement. We are funded by CDC through the Prevention First, is what we call it here in California, and 1305 for those that are involved. So today I wanted to talk about the burden of diabetes in California. I'm going to talk about the Prevent Diabetes Stat, which is Screen Test Act today. Some of you might be involved in that initiative. I'm also going to speak to the National Prediabetes Awareness Campaign in hopes that you can use some of the components. They're all public service announcements. We're encouraged to use them here in California, so I'll show you more about that. And then also what our funded local health departments are doing on behalf of diabetes prevention. And just a quick look at what the burden in California. As you can see, that the risk and diagnosis increases over age, with 65 years and older being the highest. And then it's also, there's just health disparities occurred in terms of ethnic populations. We have at the highest rate here is Latino, and then next will be Asian Pacific Islanders, African American, and then for males it's higher in males than it is females. And then the social determinants of health, where we live, work, and play. The grade school obviously affects the increased rate of diabetes, prediabetes, and the poverty level was a little too high, so I'm sure those aren't surprises. And then in California, there's a new report out that some of you are, I'm sure, aware of, where it showed that the estimates for California is 42% of California adults have prediabetes. And the CDC national numbers that came out related to their National Prediabetes Campaign showed 38% prevalence in California. These are very close, it's just the methodology was a little different. And then 15 to 30% of prediabetes patients will progress to diabetes within 5 years. So left unchecked, obviously we have a problem. We did an economic burden report that showed that $13.9 billion in healthcare costs for California. And this is an image that we've seen through Dr. Ann Albright has used this in their presentation. She's with CDC, just to show you how big the problem is in a visual. That the 29 million with type 2 diabetes is above water, but 86 million do not know they have it. It's just going to rise. So today I also want to talk to you about the Prevent Diabetes Screen Test Act today. And if you don't mind, I'm going to acronym it right away with PD-STAT. This was started last year. It's a national effort rolling out in other states. We received technical assistance from the Centers for Disease Control and Prevention, American Medical Association, and the National Associations of Chronic Disease Directors. They hosted a meeting for us last year. They asked us if we wanted help to help scale up the national diabetes prevention programs in California, and if we needed help engaging our partners, and we of course said yes. So they hosted this meeting in September. We brought together over 120 attendees from various groups and payers, insurers, businesses, healthcare and national diabetes prevention providers. And the format was, day one was, what is the current status of prediabetes in the United States and in California? So it was quite a few state and national presenters. And day two, we basically rolled up our sleeves and divided ourselves into what we call pillar groups, with the ultimate goal to develop and implement an action plan in California to sustain the National Diabetes Prevention Program, which includes quite a few things in order to get there. So in September, it shows just a quick visual. We had our launch last year in LA, And we're in the process right now of developing the plan. We have it more of an outline at this time with priorities in each of the pillars, which I'll show you in a minute. We are having pillar group calls with the members of those groups to fine-tune the priorities. Our goal is to have finished the plan by September, the action plan, and be implementing it. It will include your participation. I'm sure you'll find a place in the plan where you can, it'll benefit you and benefit us all. We have the pillar groups, they're developing the recommendations for the action plan to accomplish the priorities and facilitate the implementation, and we also have an executive committee that is our representatives from those pillar groups. So within the pillar groups, we have awareness. So that's my role. I'm the lead for the awareness pillar group. And our overall plan is to increase awareness. So we've found that 86 million people do not know that they have it or even have thought that it's even possible. So how in California can we create awareness about that prediabetes is a major health issue? And availability, increased availability of the CDC recognized lifestyle change programs. And then screen, test, and referral, increased clinical screening, testing, and referral to CDC, again, lifestyle change class program. And coverage. In order to do this, we need coverage to make it affordable and accessible. So the priorities that were defined last year and we're fine-tuning is, our number one priority in the awareness work group is to leverage the National Prediabetes Campaign, which I'm going to show you, and increase the partnerships so that we can leverage throughout the state and in many different businesses and forums. Increase awareness, and then the second is increase awareness of healthcare providers to discuss prediabetes. We are having partnership calls with LA and San Diego who receive funding directly from CDC. So they're the two largest counties that receive funding, and I coordinate a call that we talk together. And one of the biggest things that we've talked about, especially from the doctors that are part of it, is that they need to start with their own colleagues and in the healthcare system. So on the one hand, public health is working with healthcare providers and national diabetes prevention providers and doing what we do best, which is prevention. We still need to do quite a bit of awareness within the healthcare system. Availability. The priorities are, and again, these are being refined, the clinical integration and referrals to existing and future CDC recognized lifestyle change classes. Establish trust and increase buy-in and commitment for diabetes prevention lifestyle change classes. Screening, testing, referral. This is to initiate meaningful health systems change that will increase STR through training physicians and care teams on existing and emerging tools and resources. And this 12 to 18 months, I'm sure, will be changed, but that was the idea based on our CDC funding and when the contract ends. Engage the community in such a way that bridges gaps between risk for prediabetes and access. Coverage, and again, these are being folded in. There were two, the interest was so big, and last September we ended up with two groups, 25 or more per group, so about 50 people interested in coverage. So we're going to combine these this year. So for the coverage group one, they had Medi-Cal reimbursement, Medicaid plan, private and state health plan coverage, and then for our coverage two group, it was broad-based insurance coverage payer business case and statewide integrated support mechanisms. Then I wanted to share a little bit that's happening at the local level and at the state, and our funding and the local health departments that play a part with what we do. So CDPH is committed to support diabetes. It's been in the news quite a bit more. There's even talk about its prediabetes is mentioned more than obesity prevention, so it shows you how prevention and our marketing and communication really works, but that also the data is showing it's an alarming trend and uptick in prediabetes and diabetes prevalence. So CDPH receives funding for two different programs, Prevention First and Lifetime of Wellness. Prevention First is the program that addresses not only diabetes, but cardiovascular disease, obesity, school health in a coordinated way. Prevention First also is conducted at the state and local level to reduce the prevalence of diabetes and heart disease. Local health departments that are funded through Prevention First include Alameda, Madera, Monterey, and Sacramento. For those that live outside Sacramento area, you probably can coordinate with a county near you. state and local activities, we are asked to increase awareness of high blood pressure among patients, increase awareness of prediabetes among people at high risk for type 2 diabetes, promote participation in the classes, and including DSME, diabetes self-management education, increase the use of team-based care, which we have focused on that in the Department of Team-Based Care, community health workers, promotoras. Increase the use of CDC-recognized lifestyle change class for both management and for the lifestyle change classes in community settings.
Mary, before you move on,
Yes.
can you back up one slide and
Yeah.
just tell us what does that mean that the local health department, Sacramento, and we have our Sacramento local health department physician here, our public health officer. What does it mean that Sacramento has been funded for prevention first activities?
That's a broad question. We don't have our program manager here. So what it means, they're asked to, with funding, they are asked to implement and make sure that there is an increase in awareness, which could be marketing. So from this slide, they have deliverables that ask that they create a marketing plan or participate in one, but also there's an increase in the county from their work on the number of people that know they have high blood pressure. There's an increased awareness of prediabetes. That's part of the marketing. But it's also part of the healthcare provider referral and the increase in the number of national diabetes prevention programs. And then to increase the team-based care is the idea that we're all working together at every aspect where you would find the patient or the individual. And then the increased availability of lifestyle change classes. And I do have examples for the next funding, which is Lifetime of Wellness, of what they're doing. I didn't get examples for Sacramento, but we have a Sacramento representative who wanted to.
Sure, I represent the Prevention First program, the Prevention First program, and we are doing a number of initiatives to try to engage and also find out what's really out there and how willing hospital systems are with working with each other. That's been a long process. We are heavily engaged in the community health worker, life coach programs, trying to make the clinical and community linkages. So we are really, even though we're halfway through this grant cycle, we really are just kind of trudging along, finding out what's out here so that we can make the linkages and provide as much education as possible. So we are halfway through our 4-year cycle, and hopefully we'll be able to make a lot more connections with you, Mary, so that we can promote this a lot more.
Thank you. Put you on the spot. Excellent response. Thank you so much. So we're going to go into the other one, which is the Lifetime of Wellness. And this particular one, we're addressing cardiovascular disease again, diabetes, obesity. Primarily, the money we receive to this primarily all goes back out to the local health departments, which include Fresno, Tulare, Merced, Shasta, San Joaquin, and Solano counties. And I was given quick highlights for the different counties, what they reported on as of January. So Merced, they're working with a consultant in regards to the marketing, created a 2 to 4 year plan to help promote the National Diabetes Prevention Program and awareness. San Joaquin County is working with health navigators. They're also working, which is what we're doing at the state, is the Nutrition Education Obesity Prevention Branch grantees, which is excellent. It shows how we're working together at the state level and the local level. Their primary focus is nutrition education and promoting physical activity, so it's an excellent fit. They're also working with the tobacco control folks at the local level. They're working with pharmacists, Kaiser. And in Shasta, they created a Shop Healthy Shasta logo like you would see at a retail store. It's got the sticker on the front of the window that says that they are working to increase access to healthier foods, which is a nice recognition. Everyone wants to be recognized. Solano is doing a First Saturdays huge media campaign where they're pushing out the increasing physical activity and using the parks. It's another component to support good health. And Tulare has their media campaign, and it's around promoting the National Diabetes Prevention Program. Each of these programs are asked to create national diabetes prevention programs or lifestyle change programs as part of their work. So either they're contracting with someone or the agency itself is able to provide it. So there's more to come there. And they're asked, these are in their scope of work as objectives they're asked to meet, which is to utilize data to build support for lifestyle change, engage communities to build support, increase coverage, identify patients with hypertension and prediabetes, engage community health workers for high blood pressure and prediabetes, using community resources, which is important. We want to make those available at the state too, so the more we have going out there, make sure we share them. Implement referral systems between health systems and community resources.
Mary,
Yes.
that last bullet, referral systems, can you give an example of that? How is that done?
I don't know, actually. That particular thing, does anyone else in the room? No?
Some have looked at using 211 as a way, so like a community health, so you can call 211, I think, to get community resources, so trying to link up with the local 211 to provide an NDCP program and contact information if someone called and said they were worried about diabetes or thought they had pre-diabetes. So I know they're looking into those types of community referral systems. That's not an example I can think of offhand, but.
And this morning in our diabetes call, we were talking with folks from tobacco control to see if their put line would refer individuals with diabetes to NPP. So that's another example.
Okay, so there are web pages where you can, a practicing physician can easily go to find out where are the classes being conducted.
That could be one of them. We've created a map on the number of the programs in California, so certainly that could be a resource. I think someone else created what's in your community, like a community assessment and like a flyer. So people are getting creative on what that means, and thank you, you guys stuck on the wording. But yes, that's a perfect example.
Mary, the other piece is the area agencies on aging in each community are mandated to do information referral. So although that's aging, can be aging specific, a lot of it has to do with everything from food to to Meals on Wheels to homework care, etc.
But it would be nice if, I'm a practicing physician and I have diabetic patients or pre-diabetics that I can readily go to a website and point that here in our community, here are the classes that I can refer you to.
So on the website that Mary will be talking about in a few minutes, there is a link to CDC, and they have don't they have a map with all of the NDPP providers in California?
Yeah, and I think for our funded projects, we're asked that as members of the community, so to speak, that they actually create ones relevant for where they live. So that could be a website, or it could be a brochure that you get when you visit your doctor. It could be quite a few other things we're asked them to be creative in how that works.
Good, thank you.
So now I want to show you the pre-diabetes awareness campaign. And I wanted to ask before I get started, who already has an existing pre-diabetes awareness campaign as part of your organization's messaging? Oh, okay, so this is perfect. You can use all that I show you. You can use it, and you can use it today. It's just all downloadable. Social media is the easiest ones to use, which I'll show you some of the messaging. You could because it's a public service announcement, we can't pay for any placement, so it's all based on your partnership or within the system that you have, and pitching it to your management or whoever that might be that would have influence in getting these ads aired. There's billboards, posters, quite a few things. So this was put together by the American Medical Association, American Diabetes Association, CDC, with Ad Council. It was launched in January of this year. And the idea is no one is excused from prediabetes. So people often assume that there's this discussion about prediabetes, but we're not talking to you. So the number one action for this, because it's awareness, is that we direct people to the doihaveprediabetes.org website, As soon as you get there, you take the test. And then if you, depending on how you will do on the test, it takes, I think they say it takes 1 minute, it really does, it's very quick. It will say, good job, keep it up, or oh, you might want to talk to your doctor, or you do, based on this number, it looks like you have prediabetes. They always have a disclaimer, because I've always been on that. And then so the next thing would be to talk to your doctor, and to create awareness about the fact there are national diabetes prevention programs, and like we want to create systems that make it easy for providers to refer, but also that the actual individual is familiar with what it is. So the 40 to 60 second, the 40 that was created for adults 40 to 60 years of age, and they were focus group tested. It's in English and Spanish. It has, it's been placed in all the major media markets in the U.S. It's television and radio, billboard and online, social media, and again, they're in English and Spanish. And this is the look that it has, including the one on the right, Do I Have Prediabetes, is a downloadable, so this is something you can put in your office, take to health fairs. I've used the 86 million Americans to create posters, which is very effective, and again, when you have the public there and you want to engage, that gets people's attention. And then the one on the back is in Spanish. It's posters, transit ads, and the risk test. And then on this one, I hope to show you, so they updated their National Diabetes Prevention Program page. I don't know if you've been there before, but now it makes it really easy to read and click through. I think this is
Not trying hard enough. Oh, I think it's loading.
thinking about it. So this is one of the sites you can refer your patients to, or whoever you have their attention that you think would be, this would be helpful information. It has, infographics is one of the ones that I've used down here that's really nice, easy to read in one-page graphics on what is the National Diabetes Prevention Program, what is diabetes, so real simple, like start from there. What is prediabetes? These are, again, ones that I've used in health fairs and with worksite wellness. It does have what is the DBP and find a program near you. This is where that's housed at the moment for nationally. And then here are testimonials from people that have actually benefited from the program. And then it has tips and so lifestyle changes, so not the formal program, but educational nutrition and physical activity. And it's also for professionals. It has all these links to different, this site could help be a resource to quite a few different health professionals and consumers. So I wanted to share that with you. When you have time, you can click through it. And then this is the new campaign website. And if we could do nothing else, when the ads are aired, direct people to this website, we will have some success in creating awareness, because they'll get right there and take the test.
When do you think the ads will be aired?
They're aired now, so I'm not sure on the, I can ask CDC the placement in California, but they're being aired now through, I believe, 2018. It's a 2-year campaign. Radio, television, might be a billboard. I'm hoping to see billboards. So as soon as you get on the page, there it is. Do I have diabetes? You click on this and it says it only takes a minute. It does. I did it just to see if it worked when it first came out. Tells you a little bit of the stats, but as you can see, it's really easy to read. It did an excellent job. If you get a consumer here, it's going to make it easy to find things. And it has the ads at the bottom, which I'm going to share in just a moment. It's in English and Spanish. And it has the tips again to reverse prediabetes. And this is what I want to show you.
Well, Thomas, you've got prediabetes, but with more exercise and a change in diet, it can be reversed.
I'm trying exercising. I just like to be hungry for bacon.
I'll make it too. And who really likes to exercise?
Not me.
Me neither.
Nobody. So we're good.
What? Oh, you still have pre-diabetes. Big time.
I want to share another one, which is for moms.
Marie, you have pre-diabetes.
Diabetes? I don't have time to eat right or exercise. I'm a busy mom.
Oh, you're a busy mom. This is great news. Busy moms never get pre-diabetes.
Wait, what?
I mean, just, yeah, this is all the people at risk for pre-diabetes, and way over here, busy moms.
This is the big campaign. Doctors can't.
There are no excuses, I like it.
Ah, that's a good one. Okay, I want to show you one more. So this one is, this one you can take, why, the idea is that you take the, you'll see what I mean, but if you wouldn't mind taking the test, as he says, as explained, but.
It takes less than 1 minute to find out if you may have pre-diabetes. You can do it here. But you probably won't. You're busy. Kids, work, show coming back in 48 seconds. So let's do this now. Hold up one finger if you're a man, women, 0. 3 more fingers if you're over 60, 2 over 50, 1 over 40. If you're not sure, keep in mind you're sitting on a couch right now, so 1 more finger if you're not very active. 1 finger if yes, 0 if no. 1 yes, 0 no. Next, find the body type that looks most like you and hold up that many fingers while I look around awkwardly. If you're holding up 5 fingers or more, you probably have pre-diabetes. Sorry to be so blunt, but hey, you're busy. Just go.
That's really good.
What a
That's
great-
super helpful.
Yeah, all right, let's just do it right now.
Yeah, let's do it right.
But I grew full of
Yeah, it's, yeah.
smack and right upside the head.
So you can see how it's appealing. I mean, they focus group tested it, and just by the responses in the, right here, you can see it gets your attention. So this is something that you can use without, you use earned media, that is you work with your partners or with your own organization to get it placed for free. If you have a paid advertising campaign right now, often you get earned media, which they say thank you for placing your ad. You do $1 million buy, and then they say here's some free things because you're such a great customer. I'm simplifying, but so you might get a billboard and an ad placement that you don't have to pay for. So those are some of the ideas to use this. The other is to actually for where your patients are waiting. Any community, anywhere you have a captive audience that will see these ads, you can have it ongoing, playing. So it's another place that you can do that. And then something for the providers. So they have, you might be familiar with this, but the Prevent the Diabetes Stat, which is the initiative we have in California and other states. They actually created a website with quite a few resources. And I also provided, this booklet that I left at your table is one of the resources. It's an online resource, so what I did is I had extra money for printing, and I printed these so that people could actually take them home and, figuratively to your office. But it has quite a few resources in here to help you either establish this program in your department, that is to increase the amount of times that you can refer people or bring awareness in the work that you do. So, and it's associated with this website. So tools for the providers is, of course, engage the health systems.